Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back with another MGMA Member Spotlight, and this is another special one here. It's a part of our award series. Today, we welcome Kelly Ladd. Kelly is an accomplished healthcare executive with over 20 years of experience in healthcare. Kelly is the CEO of Piedmont Internal Medicine in Georgia, and Kelly has been recognized as the MGMA Legislative Liaison of the Year, and it's our great honor to welcome Kelly to the show.
Thank you. I'm glad to be here.
Yeah, so when you found out that you had been named the MGMA Legislative Liaison of the Year, what did that mean? What was your initial reaction? Shock? Were you like, oh, of course I won? But what were you thinking when this came down?
I was very shocked, and I was actually rendered speechless. Anyone who knows me knows that is quite a feat because I typically have something to say on pretty much everything.
Yeah, that is wonderful. And we're so glad to have you here today. I was talking about your background. So we're going to delve quite a bit into this Legislative Liaison Award. We'll define it. We'll talk about your work in that and what it's meant to you. But first, let's talk about Piedmont Internal Medicine. Tell us about the practice. Give us the size and scope of it, and really what you see as your role as the CEO there.
Sure, Daniel. So almost 10 years ago, I was in a health system. I was a director of physician services and got a phone call asking if I would be interested in offboarding 10 physicians from a health system that wanted to go into private practice. And the thought really intrigued me. So I decided to go ahead and go on that interview. And again, almost 10 years later, I have been with Piedmont Internal Medicine. So originally, 10 of the 11 founding partners had been employed with the health system their entire careers. They had never been in private practice. The 11th physician had been in private practice for around 25 years, was getting a little bit closer to retirement, and decided that it was time to at least join a group. He did not want to go into the private system. So I came in, and in a 6-week period, which was a very short 6-week period of working pretty much 24/7.
I would think so. Yeah.
It was a little crazy. Got these physicians offboarded. We did 2 moves in the middle of it. The credentialing, I had some help with the consulting company. And on August the 1st, 2015, the doors to Piedmont Internal Medicine opened, and I have been with them ever since.
That is incredible. And then just give us an idea, size and scope of the practice. What does that look like?
Sure. So Piedmont Internal Medicine is an adult primary care internal medicine practice. So we treat patients from the ages of 18 up until death. Okay. And we currently have 10 physicians and 4 mid-level providers and 42 staff members. So we run pretty lean and mean. We are located in the Buckhead area of Atlanta. And it's been an interesting 10 years. A lot of changes have occurred in healthcare. Most of them reimbursement, some of the contracts. We've seen meaningful use come and go. We've seen QPP kind of come and go, and now we're all dealing with the MIPS and MACRA, and it's been challenging for primary care.
Let's talk a little bit about your background then. So you are CEO there now. You're working in that Buckhead area. I know it very well. Many years ago, I worked at Bell South, which has headquarters there in Atlanta. I was working in Birmingham, but spent a lot of time in Atlanta and around that Buckhead area. So let's just go back in time a little bit, Kelly. Are you from Georgia or from somewhere else in the South? Where are you from?
I was born in Georgia. My father was in the Air Force. And when he got out of the Air Force, he became a pilot for a commercial airline. We lived up in New York, Pennsylvania, moved to the southern part of Florida when I was in middle school. So I did most of my growing up in South Florida. Went to college at Belmont Abbey in North Carolina, moved back to Florida, got into healthcare at a hospital, and decided that I wanted to expand my horizons. And it was advised that in order to do that, I needed to go into a larger city. So my sister was living in Atlanta, and I decided to move up here. That was in 1990, and I have been here ever since.
Wow. Wow. Maybe our paths crossed because the 1990, I think, was when I was working at Bell South. So, what a small world. So, let's talk about your role with MGMA then. Where did you first hear about MGMA? How'd you eventually join the organization as a MGMA member?
So I first heard about MGMA through one of the local chapter affiliates. I had been in corporate medicine. I had been in a hospital setting that almost like a mini health system, if you will, early on in the early 90s. And so I needed to get a little bit more seasoning, if you will, in the arena of the private physician practice. So I joined a local MGMA chapter, and from there I learned about MGMA National, joined as a member back in the 1990s, wasn't as active. I tried to go to as many local meetings as possible. The practice wasn't really big on sending me to any national meetings. From there, I went to another practice, and they were more focused in MGMA. At that time, MGMA would give a lot of seminars around the country. And so there was a three-day seminar on managed care contracting.
Okay.
So as you know, back in the 90s, as PHOs were developing and all of that were coming about, it was really important to understand the contracting side of it. So from there, I just got more exposed into national MGMA and would attend meetings, as many webinars as possible. Got hooked into the state MGMA. And so, goodness, for the past 15 plus years, I've been active in local chapters, the state chapter, as well as the national chapter.
Yeah. So you described Piedmont earlier as lean and mean. You're real, run a tight ship there, and it's a sort of that small to medium-sized practice. What does MGMA mean to a practice of that size? Talk about that.
I think it's critical to be a member of an organization such as MGMA. The information is great, but what's even better is the networking, being able to go to these conferences, meeting other people from practices that may or may not have the same scope of practice as far as, services or ancillary services, whatever, but just really being able to meet people, get some ideas, network to the point where if you run into a situation that you've never encountered before, then you can pick up the phone and actually call somebody and say, hey, I remember when we were at MGMA, we went out to dinner and we were talking about this subject. And I remembered that you had mentioned that you had some experience with this. Can you help me out? And that is really critical because so many things change, especially in the areas of human resources. Larger practices that are operating within health systems, they have an HR department or they have a credentialing department. Or if there's a financial question, they can pick up the phone and call somebody in accounting. When you are in a small to medium-sized practice, whether you're the practice manager, the CEO, the CFO, you're it. As the CEO, I wear a lot of different hats. So yes, I do have a management team in my practice. I do have someone that handles our human resources. I have a business office manager and a practice manager to handle the day-to-day things. But I still have to know and understand everything that they're doing. So it's everything from understanding compliance with human resources to all the rules and regs we have to know for CMS, knowing the landscape of IT services, understanding cybersecurity, understanding insurance, and not just third-party insurance so that we can get paid, but also understanding all of the insurance benefits for our employees. I have to understand facilities management, be able to design space and study workflow in order to maximize, number one, the space, because real estate is not cheap anymore, as we all know, but also that workflow to make sure that I'm maximizing the resources of the people that we have so that we don't get bottlenecks, whether it's in our lab services or other services that we may have within a scope of practice with internal medicine. So there are all these different nuances, understanding finance, being able to get into QuickBooks and read financial statements, balance sheets, troubleshoot problems, understanding the revenue cycle all the way through from the time the patient checks in and we get their demographic and insurance information all the way until that patient account is a zero balance. I have to know it. And there's so much that the person sitting in my chair has to know. If you don't have a resource such as MGMA and everything that goes with it, whether it's other administrators or even just the resources MGMA has through some of their data dives or their manuals or the consulting services, you're just opening yourself up to a world of hurt, because these days CMS doesn't care if you make an innocent mistake. Right. You make a mistake, they don't care. Ignorance is not a defense. Mm-hmm. And so there's a lot on the line, and I don't think people truly understand. I don't even think the doctors always understand what goes on behind the scenes in the medical practice and the liability that the administrator is responsible to prevent from happening. It's not just, everyone focuses on the malpractice liability. They forget about everything else. They forget, well, the EEOC can come knocking on your door, or OSHA can come knocking on your door, or CMS can come knocking on your door. And so there's a lot of risk there on the business side. The business of medicine is not like any other business in this country, or probably even the world. And it's very complicated, and there's a lot of rules. And if you don't have the resources to be able to see what those rules are, if you have a question, you can get in a lot of trouble. I mean, and you can lose your ability to even practice your crafts, if so to speak, in your current role. If CMS sanctions you, you don't have a job, and right. And you don't have any recourse. I mean, you will never be able to work in any industry that holds a government contract. And that's a huge risk and a huge liability. And I don't think people really understand that the way that they should.
Thank you for sharing that. That was a really powerful statement. I want to go into one of the topics that we really want to focus on today, and that is you being honored with the MGMA Legislative Liaison of the Year award. How did you get into that side of it? Because there are a lot of ways you can get active. A MGMA member can get active with different groups within MGMA. So how did you gravitate to this legislative side of it?
This actually started several years ago when I was in the ENT space. Okay. So I had been an ENT administrator for around 14, 15 years. Mm-hmm. And when I was in that role, I was actually very active with the board of another organization. So I had belonged to that organization as well as MGMA. And when I became president of that organization, this goes back probably at least 15 years, I did a lot of work on advocacy with that organization, as well as the physician side, that academy. And so that entailed me going up to the Hill in Washington, D.C., and doing some grassroots advocacy for different legislative items that were coming across the desk of Congress, and either advocating for or advocating against those policies. So that's how I actually got started. Fast forward 10 years, I started getting very active with our state chapter of Georgia MGMA. And again, that entailed going to Doctor's Day on the Hill for the state. I got involved with the Medical Association of Georgia and their grassroots advocacy. Started out with third-party payer type of issues. They were finding that they could get the doctors to participate with some things, but what was lacking in some of the legislation in Georgia were the unintended consequences. And some of those unintended consequences could only really be seen through the lens of an administrator, because again, it's great when the physicians are advocating for medical care and making sure that we're treating patients appropriately and safely. They're not really in tune to how to get there administratively, or sometimes even the financial impact that some things can have, whether it's legislation between the insurance carriers and the physicians, or maybe a state law that comes across that people don't fully understand the impact until it happens. And then it's oh no, now what do we do?
Yeah.
So from there, I started seeing a lot of overlap between some of the things that we were trying to do in Georgia. For example, some of the pre-authorization legislation that has been happening, and other legislation where the Fair Billing Act, there has been some local type of things that have come across in Georgia, as well as on the national level. So as I started seeing some of that overlap, I started reaching out to MGMA in the Washington office saying, hey, this is what's going on in Georgia. Yeah. And I see this is what's happening on the national level. And, is there a way that we can combine the two and start working? And things just really from there started growing, and I started becoming more active on the federal level because I could see where the impact was. And I started attending every Washington seminar that I could do. I started getting very active on the discussion boards, and before I knew it, was getting phone calls from Anders saying, hey, we have some questions. Can you help us out? So I was doing that. I was also making sure that I was writing my both state legislative representatives as well as the federal representatives on various issues, but just pounding the pavement, if you will, sending out letters, sending emails, just trying to get the word out, because I could see that there, again, were a lot of really good intentions with some of the proposals that either CMS was making or Congress was making on the federal side, or maybe some of the legislation that our senators here in Georgia or representatives here in Georgia were trying to push through. But I could also tell they weren't understanding the impact that it would have operationally on physician practices. We go back to the lean and mean. When legislation passes with the good intention for the patient, they don't always understand what that means for the physician. The difference can mean that I have to hire one or two people. Reimbursement has been steadily decreasing on the CMS side for years and years, while inflation and expenses have been increasing. And we're in some dangerous territory right now, because reimbursement continues to go down, inflation continues to go up, and we're all fighting for dollars for survival. And so we need to have Congress and CMS understand the impact financially that they're having on physician offices. Hospitals, larger systems, they're able to get funding from other sources in many cases. Private physician offices, we don't get any funding outside of what we collect from an insurance carrier and or the patient. And so we are very mindful of those dollars. So if I have to hire one or two additional staff members in order to comply with a state or federal mandate, then I'm taking something away from somebody, whether that is the doctor's paycheck, because at the end of the day, after the staff are paid, after the bills are paid, whatever's left over is what the physician gets paid. So, if I have to hire another person, it's coming from somewhere. So it can come from, unfortunately, in some cases, even patient care. And, it's not that we're compromising patient care. When I talk about taking away from patient care, it could be that instead of having that nice, soft, laundered hospital type gown that you get when you're having your annual physical, that's not as scratchy, to having to switch to a paper gown because the paper gown is cheaper. So I don't want anyone to think that we would be compromising our patient care as far as treatment, but it does mean that I might have to go other places for other things that have an indirect impact on that.
Yeah.
Or again, it comes out of the doctor's paycheck. So every time someone's trying to pass something and they're not fully understanding the full impact of what they're trying to accomplish, that's where I come in and basically state my opinion. In some cases it works.
Yeah.
In other cases it doesn't, but I really have found over the past several years that people are willing to listen. And when we're able to bring up how that adversely affects the physician practice and how ultimately it can have an impact on the patient, people have that aha moment. And then I can help work with them to tweak that bill or tweak that idea so that we get that win-win situation. Because, we always want the patient to be safe.
Right.
And I don't know anyone that is not an advocate for giving good health care to patients in a cost-effective manner. And we really try. I wish the American public understood how hard we work to try our best to make healthcare affordable. The physician cost of healthcare is around 17% of all the dollars spent are physician dollars. When you're looking at the entire picture, that's less than 20%. So other people are getting that 83%. There's some misinformation out there where people think, oh, the doctors are putting all this money in their pocket, and they're really not. 17% is not a lot of money in the grand scheme of things. And so with that 17%, we really try very hard to contain the cost as best as possible, because it has a direct impact on us, not just as providers, but people have to remember we're also employers. So we're paying to insure our employees, but we're also patients. So we're also paying doctors when we go to the doctors. So we are also consumers and are mindful of deductibles, co-insurance, and co-pays. So I think that also gives us a unique perspective as administrators to be able to share those stories with grassroots advocacy efforts as well.
Yeah. Thank you so much for sharing that. Now, in reading about the Legislative Liaison program, at its heart is really about education and grassroots involvement. Speaking directly to those MGMA members who are listening, who may be thinking about, well, maybe I do want to get involved here. What would you say to them? How do you get involved? Anything else you want to share about the program itself?
I think it's really important for members to, number one, if you have the opportunity to serve on a committee. So in Georgia, we do have a legislative liaison committee that has not been as active, but we're trying to change that. I'm learning to delegate better. So that's one of the things that I'm learning to do. Part of it is having that committee help introduce MGMA to state and federal legislators. The other thing as a member, when you get an email that is saying, hey, will you fill out this survey? Or you get an email that says, will you please read this material and send it to your congressman and or senator. I should also say congresswoman. Yes. I don't know if we've come up with the term congressperson yet or not, but reach out to that representative. MGMA makes it so easy. You literally less than 5 minutes, you can type in your name, your zip code, and MGMA does the rest. But look out for those emails, because on the grassroots advocacy level, this will affect you. The laws that are coming out, whether it's state or federal, they will affect every practice in one shape or another. And we have to pay attention, or else we're going to get more legislation on HIPAA, on PHI, more legislation on no surprise billing, being able to have a say in pre-authorization. There were a lot, I don't think a lot of people really understand that some of the pre-authorization language that was first introduced in these bills had some things in there that really would have added a lot more work onto the physician practice than what we could handle. And had it not been for MGMA and people that are in my role across the United States, basically knocking on the door of CMS and Congress saying, hey, we're all for standardizing this, because we don't like to have 20 different formats in order to get a prior authorization. So yes, we agree something needs to change. However, we would like to suggest that you do it this way if you want to achieve maximum efficiency without killing the doctor's practice and their staff. And so this is the type of advocacy that is really important. And what matters in advocacy are numbers. If it's only a few people screaming the loudest, Congress may be, okay, yeah, we hear you, but we don't really hear you. If you have 100 people screaming, then that gets people's attention. So it's really it's a numbers game, so to speak, and that the more people that Congress hears from, the more people that our senators hear from, then the bigger the impact. That, along with patient stories or even personal stories, giving the story of how something could negatively impact a patient is very powerful, but also telling stories of a way that you did something in your practice that helped a patient or helped contain cost for a CMS patient or whatever the case may be. So a lot of times it's also getting the story out as well.
Final question here. I found this so fascinating in reading about you and learning more about your background. You're not only giving back in your professional career, but on a personal level, I found out that in your spare time, if we can call it that, you're also, I'm going to get this right, a Taekwondo instructor, and you also advocate for homeless youth. First of all, I don't know where you find the time to do all these things, but secondly, tell us about that, giving back in those regards as well.
So way back when my son was little, he started doing Taekwondo at a local academy, and I wanted to lose weight. It looked like a lot of fun, and so I got involved. As a student, I became an instructor because I wanted to actually spend more time on the mat with my son. This type of career, I've spent a lot of hours working, and so having more time with my kids was something very precious to me. So I got into the program with Tiger Rock Martial Arts, and fast forward, I became a certified instructor around 10 years ago. I currently hold the rank of a 6-degree master black belt. And it's been fun. I've had to be out of it a little bit this year. I ended up tearing my Achilles tendon at the end of March, and I'm still trying to recover from that. But interestingly enough, that that experience has helped me grow in many ways. With Tiger Rock Martial Arts, they actually require certified instructors to teach a certain amount of classes per week. And so giving back into the community through that is that it helps the academy owners keep their tuition down. So, we want more kids to have a positive experience in Taekwondo. There's so many tenets. It's not just about learning martial arts. It's learning discipline. It's learning a sense of community and giving back to the community. One of our mottos is, leave a place better than what you found it.
Yeah.
And that always resonates with me on so many levels. So there's that part of it. And I hope and pray that I'll be able to continue until my last breath. The homeless youth, I've been involved with Covenant House, and now, Covenant House is all over the world now, but Covenant House of Georgia, it is a homeless youth shelter. Again, a lot of people don't realize how large our homeless youth are. The population is around the United States. And those are kids ages basically 16 through 22. Kids that age out of foster care, typically in many states, the age is 18. Around 10 years ago, Georgia upped it to 21, that when you turned 18, you could either opt to go out of the foster program or you could continue to the age of 21. I think sometimes, unfortunately, our population forgets that they're still kids.
Yeah.
And they need some type of support in order to survive. There's a lot. Don't want to go into all the sad stories. But this has involved spending the night, basically sleeping in a sleeping bag on a cardboard box in very cold weather outside to simulate what it's like for these kids to go through. And so something near and dear to my heart, and it's a great program. So I really encourage anybody watching this, find a local Covenant House or other youth health shelter. We have a lot of programs for elderly people and families. And unfortunately, this is a population that people just don't think about.
Well, Kelly Ladd, thank you so much for all the work you're doing for homeless youth, for Taekwondo students, for MGMA members, and congratulations on being the 2024 MGMA Legislative Liaison of the Year recipient. Thank you.
Thank you, Daniel. I really appreciate it. And I appreciate MGMA. It has made me the administrator I am today.
Yeah. Well, that is going to do it for this episode of MGMA's Member Spotlight podcast. We have been joined by Kelly Ladd. We're going to provide links in our episode show notes that will provide you with more information on the award and also on the Legislative Liaison program, so you can get involved in that as well. So until then, thank you all so much for being MGMA podcast listeners.